Hey everyone, this is Drew back again at VCS 2017 at the IM3 booth with Dr. Chandawarkar, a resident at Johns Hopkins, right?
Yes, yes.
Welcome. How's the show going?
It's going great. Having the multidisciplinary aspect of this is really great from an educational perspective for the residents because we are trained in our own specialty. We don't get to see what the other specialties are doing.
Gotcha.
Yeah.
Is this your first time at VCS?
This is my first time at VCS.
How would you compare this conference to other conferences that you've attended?
I think just the ability to have the dermatologists and facial plastic surgeons, both from seeing the technologies that are here at the conference that in the exhibits that we don't have at ASAPS or ASPS.
Yeah.
As well as the talks from them that we generally don't get either. So
cool.
I think it's a win-win in that regard. Yeah.
Well, any favorite sessions that you've attended so far?
I really liked a lot of the body contouring stuff, as well as a lot of the technology stuff. I'm particularly interested in new technologies.
Okay. What kind of new technologies?
All the non-invasive technologies I'm really interested in, especially looking on the FDA side, what things have been approved recently, and how those go through the process, because the FDA doesn't really care much about effectiveness for the level of use that we use it in our practices.
Okay.
So it's been really interesting to see,
Gotcha.
talk to the guys about how they went through those processes.
Yeah. How much longer do you have in your residency?
I have 4 years left.
4 years left.
Yeah, I took the last year off, and I was working. I was doing a fellowship at Stanford in medical devices.
Wow.
So really interested in the intersection of plastic surgery, aesthetic surgery, and devices.
So do you think when you eventually have your own private practice, do you think you'll be a lot more technology for you versus surgical?
I think surgical is still going to be the mainstay, but I think technology is really interesting in getting people in the door.
Yeah.
It's a lower threshold for people to get the non-invasive stuff done.
Right.
And honestly, it's, the need is getting better results for the patient, and so whatever's in your armamentarium to do that is important. So if you're only offering surgery, you're not giving the full. You're not doing your patients. You're doing them a disservice if you're just offering surgery.
Right on. Cool. Good stuff. Well, let's shift gears here for a little bit. I'm gonna ask you some fun personal questions. What's your favorite color?
Blue.
Nice. Sports fan?
Yeah, I'm a huge New York Yankees fan.
Nice.
Grew up in the Jeter era, so
cool.
I got to see his number be retired this year. And then a Pittsburgh Steelers fan, which is tough in Baltimore.
Where are you from?
So I'm from Jersey originally.
Okay.
My fiance is from Pittsburgh.
Okay.
So she was a Red Sox fan, and I'm a Yankees fan. So I said, you have to give up the Red Sox. And in exchange, I had to give up my football. And
that's a fair trade.
It's a fair trade.
That's a fair trade.
A dog named after Troy Polamalu. And
no kidding.
Exactly,
so Pittsburgh Steelers. So what do you think? I think Pittsburgh Steelers are going to be pretty good this year.
They're always contenders because you never know what Big Ben's going to do.
Yeah, exactly. And this is what looks like maybe his last year.
You never know. He's made of masking tape and somehow puts it together, right?
And he's just a beast in general.
Yeah.
Cool. What was the last thing you watched on TV?
I was watching The Keepers on Netflix.
Okay.
Looking at some of the stuff in Baltimore going on. There's always interesting stuff. The Wire, The Keepers.
Okay, I haven't watched that, but I'm a Netflix guy. So far, everybody I've asked that question, it's all been Netflix. It's like people don't watch TV. Yeah. That's because you can binge watch it
exactly.
now,
I actually prefer to keep the TV on just as background. So I like having cable TV and sitcoms and stuff like that.
Yeah. Cool. What would you do if you won $10 million?
It's a good question.
I would retire.
I have well, first of all, I have a wedding to start paying for coming up, so
that'll take 5 of it.
It's going to take. Indian weddings are expensive, so.
Oh my God! I heard Indian weddings are amazing.
They're crazy. So we'd probably extend it longer than we're planning on.
Okay, cool.
Yeah, so that's probably first.
So what would you do the rest of it then?
I think I would honestly start investing it in new technologies and early startups.
Yeah.
And I have a few kind of fledgling startup things going on, so funding those would be exciting too.
So is that something? Is that a passion of yours too? Do you see yourself maybe down there, not maybe just being a plastic surgeon, but you're an innovator of a new device or technology?
Yeah, that's where I'm hoping my career goes. That I'm taking what I see in the clinic and the needs that our patients have, and some of the poor results in certain areas.
Right.
Innovate around those.
Yeah.
It's the needs-driven process that they taught us at Stanford Biodesign, and that's what has created a lot of really important companies that you see at the exhibit hall here today.
Exactly.
So it's really cool.
Knowing what those needs are. So many people start businesses where they're not thinking about the needs of the patient, the customer. Yeah. And they think, oh, we'll figure out how to sell this, but it doesn't work that way.
Exactly.
What were you like in high school?
I was engineering nerd.
Okay.
Kind of typical engineering nerd. We had a magnet program, a science and engineering high school, so we did that. But I also was in a band that toured around.
Like a real band,
a real
not marching
band. We opened up for Bruce Springsteen at Giant Stadium.
What?
So
that's huge.
Actually, right before going to college, our last show, they actually drove me up to college, and we played our last show at college campus.
What musician or what instrument? Excuse me.
I did a little bit of everything, but so we were a ska band, so we had a horn section.
Wow.
We had guitar vocals. So I did guitar and vocals.
Okay,
mostly,
cool. I'm a drummer.
Sax. We had trouble getting good drummers throughout.
It's hard. It's really hard to get.
Yeah, so
they're either really good, but they're flaky, or they're not good.
Dime a dozen, and everyone can sing in the shower, but it's hard to find a good drummer.
Totally. That's cool. So are you from the Bay Area?
I'm from Jersey originally.
Oh, that's right. You just said that. I'm sorry.
Yeah. So that's where Bruce Springsteen and the whole Jersey music scene.
But you went to Stanford. Where'd you do your undergrad?
I went to MIT for undergrad.
Wow.
Yeah.
So you went to MIT. You went to Stanford.
I went to MIT, then I went to Harvard for med school. I started residency at Hopkins, did 2 years, and then took the year off to go over to Stanford and do this fellowship because I was really interested in this startup life.
You are a machine.
I just keep racking up degrees. My mom's trying to figure out when she has to stop.
From the best schools in the world.
She has to figure out when she's going to stop going to graduations and see me actually getting some paychecks.
That's cool. So obviously education, you love to, you obviously must have a passion for learning.
Yeah, I mean, I really like, there's just so much, over every 5 years, there's a huge paradigm shift in technology and what the new thing is and the next wave. So medicine's changing at an insane rate.
Yeah.
And doctors aren't the ones who are driving that ship. It's the technologists and the administrators.
Yeah, so, totally. Why'd you want to become a plastic surgeon?
So twofold reason. One of my mentors in med school told me to choose my specialty based on the type of patient population you want to treat rather than a technology or procedure, because those will go out of style, but your patients will stay the same.
That makes sense.
So I found the aesthetic population particularly very motivated, and other places in medicine, they're not as motivated. It's really hard for them. Cancer patient, it's really hard for them to kind of really seek and be excited about what's going on in their treatment. So you have people leaving your clinic that are oftentimes not as happy than when they came in, and that was really kind of downer for me. Because I'm a very positive person. So I found aesthetic surgery to be really interesting. That you have really excited people who are come in sometimes with literature. They said, I heard about this new toxin. Tell me about it, or something like that.
And then they leave happy.
Yeah. And then the second side is I took a year off in med school and I worked with a face transplant team at Brigham and Women's Hospital, and that was all run by plastic surgeons. And that's really the first time I saw that plastic surgeons were really the kind of original innovators. They, Joe Murray is a plastic surgeon. He did the first kidney transplant. Most people don't know that transplantation has its roots in plastic surgery. And that's why now we do the face and hand and penile and all the different ab wall transplantation. So spending a year with Dr. Pomahawk at Brigham and Women's Hospital, he showed me that plastic surgery is really where innovation's happening, and I was really excited about that.
Cool.
And he really showed me kind of how to incorporate that into a practice and bring something completely new they've never done before. No one was trained in that stuff. He had to learn it on the fly.
For sure.
So it was really great, and so I got exposed to all the plastic surgeons through that, and then fell kind of into it because it seemed like a right fit.
Yeah, right on.
So
good stuff. Thanks for joining us, man.
I
can't wait till you're done with all your schooling and you're an innovator in this industry. I think you're going to do some great things, man. I can't wait to see that.
Thank you. I really appreciate it.
Yeah, no worries. Thanks for joining us.
Thank you.
You're welcome.